drug testing. While it shouldn't be the sole focus of your program, it does play an important role in maintaining a drug-responsible workplace. It's the only objective way to tell if an employee is under the influence, and testing also helps deter use. The casual user might think twice about using on the weekend if they know they could be tested during the work week. Finally, it can help break through denial of a problem and get an employee help before things progress further. It's important. But remember, we also need to be sure that employee rights are protected. Drug testing is search and seizure under the Fourth Amendment, and an alcohol test, according to the ADA, is a medical exam. So you want to be sure your policy clearly describes what drugs you're going to test for, how you're going to test, like urine, breath, blood, and when you're going to test, also referred to as testing applications. Let's talk about those applications that are reactive, that you do in response to a situation. Now we'll cover proactive testing applications and those tied to sending someone for an alcohol or drug assessment in other videos. So there are two main applications of testing that are considered reactive. First, post-accident, which happens against your company's objective definition of an accident, a definition which should be tied to things like the amount of damage done and the severity of the injuries. And you need written procedures around post-accident testing too, like the time frame in which the test will happen, when an alcohol test will be done, and whether the person will be transported to the collection site, and finally, whether you'll keep them off the job while waiting for the test results. The second reactive application is reasonable suspicion, which is triggered when a trained supervisor has objective and documentable reasons to believe that an employee could be under the influence, which is why it's so helpful to have a reasonable suspicion checklist as part of your policy documents. And your policy should also cover procedures, like how the person will be transported to the collection site, and again, whether they'll be paid while waiting for the test results. Now, with both post-accident and reasonable suspicion testing, if your employees are mandated by the Department of Transportation, be sure you're following DOT's definitions and procedures appropriately, because they're likely different than your non-DOT guidelines. Now, since both of these tests are triggered by an employee's actions, it can be stressful. So it's important that you set emotions aside, follow your policy to a T, and document. It's also important that the correct testing application is ordered and on record, especially if the test is ever contested or a workers' comp claim becomes a part of the situation. So make sure you're following your policy and procedures to maintain the integrity of your program and to protect your employees' rights. We know that these and other testing applications can trigger a lot of questions. So if you have questions about when, how, or what you should be testing for, we'd be happy to help. Just reach out.